Today, we welcome you all to the premises of Calcutta Institute of Pharmaceutical Technology and Allied Health Sciences to our three-day workshop organized by the Department of Pharmacology, and we head on with this workshop title with the three-day course, Core Technique in Experimental Pharmacology, Animal Handling and Rules of Administration. A warm welcome and a very good morning to all of you here right now present, and my heartfelt welcome to our principal sir, our research director sir, our vice principal sir, and all the senior faculty members and my colleagues and my beloved students. It is giving us a great opportunity that every year consecutively we are able to team up to such events here, and we can really boost up your knowledge with all these practical trainings along with your parallel course curriculums which we all are performing, you all are doing in your premises. So firstly, I would like to start with the inauguration ceremony. So I will first start with our respect and homage to our pioneer, Professor Ravindra Devnath sir, and I would all request our principal sir, research director sir, and senior faculty members to please come up to put their floral homage to Sir and light the lamp, inaugural lamp for today's auspicious event. I request the volunteers to please put up the lamp because of the smoke cases are on. Thank you all. So here we have a good start for this event. So on this first occasion of the inauguration address, I would like to request our respected principal sir, Professor Venkatesh Perumal sir, to please come up on the dais and address the fellow students who have gathered from all the external institutes to be a part of this auspicious workshop. Thank you, sir.
Good morning. Respected Mr. Director, Manager Sir, Vice Principal, HODs, faculty members, and participants from different colleges. I'm happy to see all of you here. Also welcome all the participants of various colleges to actively participate in the 3-day workshop. But in our BPharm curriculum, if you know that, right, so there's no animal studies. So all we are doing only with the simulation. Still, I remember during my BPharm, probably in the 1990s, right? So we had all these animal studies in BPharm. Actually, the small animals like mice, rat, as well as rabbit, the college used to provide. But no, the college asked us to bring the frog. So we used to, okay, every student out, we have to bring our own frog. Still, I remember, right? So there's a ciliary movement, just instrument was there. We used to dissect the ciliary, expose the ciliary muscles, and then we used to have poppy seeds. I think this generation, I think they don't have the kind of exposure, particularly in the BPharm level. I think it is. I feel it is because now people are getting certificate BPharm certificate before just not even touching the animal. So that I feel it is yeah, somewhere we are lacking. But of course, due to ethical consideration, Right? You know that, right? But CPCSA is playing a major role now. So those days, no, this CPCSA, those days is not much effective. Even though it was there, they were not much stringent. But these days, no, these regulatory agencies are very much stringent of using these small animals, small level animals. So okay, so to actually to bridge this background, so we are conducting this program, right? As you know that we have a full-fledged animal house, which is CPCSA approved, right? So we are handling this rat, mice, all those things, and we are going to get the hands-on experience in the coming 3 days, right? So, for example, animal handling as well as the various routes of administration. Right? In previous workshops, we conducted various workshops like neuropharmacology and ECG in small animals. All those things we conducted. So, in continuation of that, so today, we are conducting this. Maybe you can take it as a big scope program, right? So I feel what all people know. So maybe we are very strong in the theoretical, but practical also is equally important. I can go further and say, right, practical means training of practical skills is more important than the theoretical skills, theoretical knowledge. I feel, but I'm not saying that theoretical knowledge is not required. It's required, but practical is okay. People know this. I know that this generation, okay, so they're lacking the practical knowledge, which is it's very much important to fill the gap between the academic and the industry. Mostly the industry they're looking for the skilled people. Skilled people means those who are having practical exposure, right? So I hope this workshop will um, fulfill the gap for your practical training. I'm requesting all the participants, right? Uh, Kindly actively participate. So we have the faculty over here and informed secondary students. They are going to okay, going to explain you all the aspects regarding handling and various rules of administration. Okay, you please actively participate in this 3 days program. So that's the important, right? So it's not that namesake we are connecting these workshops. Okay, so there should be some output should be there, right? At the end of the 3 days, so you should say that okay, we are confident that we can handle the animals, okay, and we learn about the various rules of administration. That's what we want. Okay? Just not like for namesake we are connecting the workshops. Okay? So that you please take care, and I also congratulate the entire team, the coordinator, convener, professor, and conveners, coordinators, Dr. Nilanjan, Mr. Pari, Dr. Pai, and all the faculty members, and as well as the second year pharmacology students as well. Uh, so please, okay, actually continuously working on these workshops. I hope okay, all the participants will have a good time in the coming 3 days. Thank you.
Thank you much, sir. With these words, I think we can really have a good focus on the next 3 days of this workshop. Next, I would like to call upon on the dais our respected research director, sir, Professor A.T. Bhanuji Rao, sir, for his valuable words and directions to the students.
Respected Principal of this institution, Professor S. Parmal sir, Vice Principal, Professor Balindar, convener of today's workshop, that is some videos, program coordinators, Nilanjan Pari, Ayal Madam, and other faculty members, and my dear student friends, particularly the participants from different colleges. I'm very happy to see all of you and extend my warm welcome to CIPT. Good morning to all of you. Well, we have been organizing workshops to enhance the practical and technical skills of the students. Apart from the regular curriculum, that is theory and practicals, but this is an additional opportunity for the students to develop their skills in various uh, handling the equipment and other things. And the other departments, apart from pharmacology, pharmaceutics, biotechnology, and chemistry, pharmaceutical chemistry, we have been organizing in various areas. So today's particular is experimental pharmacology, that is handling of animals and route of administration. This is very essential, as you know, to advance, particularly biomedical research. Animal studies are very much critical and essential because without understanding the disease, how to treat, how to evaluate biological activities, about the safety, efficacy, and toxicity. This is a very important part of the drug development and discovery, and also vaccines. So therefore, as we know, animal studies are very much essential for any new drug being discovered has to undergo preclinical studies. Preclinical studies, efficacy and toxicity and safety being studied on various animal models. Then only we go for clinical studies or on human volunteers. So that's why the animal studies are very much important. And yeah, so understanding disease, how the disease progresses. So these are very much plays important role for the drug development and biomedical this advancement. At the same time, it's very important that we should not subject the animals to pain, unnecessary pain and sufferings. That is very much ethically very important. So that's how we have uh, CCR, CPCSA guidelines, how to handle the animals, how to take care of them before the animal studies, during the studies, and as well as after the experimentation, rehabilitation. So very, very important. So therefore, uh, we have approved of the registered animal house under CCA, as you know, this is a committee for control and supervision of experiments on animals. So the guidelines are very stringent as per Professor has already told. So we have to follow all these guidelines, ethical values, right? Handling the animals, we should not subject them unnecessarily to pain and the suffering. And as far as possible, we have to reduce the number of animals, the refinement, and also uh, ensure that during they are well maintained in their when you are using these animals. So I think these guidance are very much important, and maybe I'm requesting our faculty pharmacology to give some idea of the CCSA guidelines so that students will also know before handling the animals and using diagnostic by various routes of administration. And I think I am happy that there will be also a visit to our animal house as our principal said. We have well developed and good animal house. And maybe some of your institution also may have it, but we have a very good animal house which you can visit. That will, I think, a very good idea about this animal handling. And this particular workshop will definitely, I wish that will be immensely benefited. I once again welcome you all and actively participate to get maximum benefit. And I want to congratulate the head of department of pharmacology and other faculty members for having work together to see that this 3 day workshop goes smoothly and successfully. And I'm also happy that next week we have another workshop by Pharmacology department on advanced instrumental analysis. So this is a part of our efforts to see that the students are given an extra benefit while they are studying the regular curriculum. Thank you very much once again. Thank you for giving me this opportunity.
Thank you so much, sir. Yes, we are about to start back-to-back workshops from different departments from our so esteemed Institute of CIPT and Allied Health Science. Next, I would request our convener, sir, who is the head of the department, Professor S.M. Fiddler, sir, under whose guidance we can always frame up such good workshops for you. So I would request sir to please come on the dais to address the students.
Good morning, respected principal sir, vice principal sir, research director, and my dear colleagues and my beloved students and the participants. Actually, this workshop on the animal handling or the core or the basic animal handling as well as the route of administrations is very important because these are the very basic techniques are there in the pharmacology or the experimental pharmacology which are everyone should know about this, otherwise they cannot go with the drug administrations or the effect of the drugs they cannot evaluate. So in these aspects, the first basic thing is the handling of the animals. So you should know how to handle the animals and how sophisticatedly you have to handle the animals without any kind of stress you can produce onto the animals. And apart from that, the route of administrations, you will learn the various route of administrations, right from the oral route to the parenteral route, and in addition, the collections of the blood to estimate the different parameters or the different biochemical parameters or different protein parameters. So the collections of the biological fluid is also required. So in these regards, I would like to say that we will be having a very good these 3 days workshops hands-on, and you will be able to learn a lot of techniques. And this is actually in our syllabus also there is one gap is there, that is nowadays all the pharmacological experiment or the experimentations are simulations type of studies. So where generally we do not get exposure to the live animals, particularly the students do not get the exposure to the live animals. So because of that only, this workshop was planned, and I hope that we will be having a very good sessions in these coming 3 days, including today. So thank you once again, all the participants who joined over here. So I welcome all the participants once again. Thank you.
Thank you, sir. And next, I would like to call upon the coordinator for this workshop, 3 day workshop, Professor Dr. Nilanjan Bhavi, sir, who will be also with us for the 3 day demonstrations. So, sir, please, we request you to come on the desk.
Good morning, our respected principal sir, our research director sir, our vice principal sir, and other colleagues and HOD sir also, and our students and new students who are coming from the different colleges. And thank you very much for your interest related with the handling of the animals as well as the route of administration. Actually, day by day, we always follow that every pharmaceutical company are merely opening the research and development sector. And actually, they also open the pharmacovigilance as well as the clinical trial and the preclinical option also there. So ultimately, the preclinical means that is also related with the animals, and mainly the rat and mice are mainly related with the human beings. And in case of suppose you see if you are thinking regarding the genetic genes, that is the 90% similar to the human beings. And not only that, the every system also similar to the rodents. And another point also there. So at the time of the development of the drugs, before coming to the market or the clinical trial, we should have to go for the preclinical study. So for the preclinical study, you have to go for the different law. You have to the handling of the animal because the animals are also mainly used for the preclinical study. Okay. So ultimately, if you are not know regarding the handling of the proper handling of the rat or mice or do not know the route of administration, so we are not go for the further study. That's why that is also very important. So that's why our HOD and the department also plan for the proper technique for the route of administration as well as the handling of the uh, our animals and collection of the plant by which we may go for the different biochemical parameters. That is very important. So I wish you for the very good, you learn from the CIPT very properly. And best wishes for the 3 days. If any problem is arise, any question is arise related with that, ask me. No problem. We are always inform you, and we are also inform every technique and very careful. And you should have to, and not only that, our college also got the CPCACA permission and more than 7 years. So without that permission, we cannot go for that that type of workshop. Okay. So best wishes for your the 3 days workshop, and not only that, we already enter one the kit. You observe that one leaflet also there. There are so many research work also work in our laboratory in different department. If in future that is required, then you may contact with us. Okay. So best wishes for 3 days. Okay. Thank you.
So I think our coordinator sir has told you elaborately what you are to be here. So before we go to the scientific session and today's session, as sir mentioned that there should be no hesitation because you have come here to learn something. So with all your limitations and boundaries you have to overcome. We will make a very friendly approach. We expect you also with all your queries without any kind of hesitations you should come up. People who have already been here in workshop, I think they have got this experience earlier as well, what sir said, that they can approach, they can ask your queries. So until and unless you are sure that you have learned the technique, so you can ask the question. So we want a very happy days to come for these 3 days. You can enjoy and you can really learn something which will be beneficial for your career, for the B.Pharm career. So with this, we like to end up with our inaugural session, and then we are going to start with our scientific session 1, where we will start up with the lecture. So just give me 5 minutes, so that we can just arrange for it. Okay, just have some patience.
আমি সার্চ করে তুমি আমাকে শেয়ার করো আমি ওটা দিয়ে দিচ্ছি। হোয়াটসঅ্যাপে। ওকে পকেটে বাম দিকে বাম দিকে বাম দিকে আচ্ছা তো আমি ওটা দুটো নিয়ে নিচ্ছিলাম।
Hello.
না ও চলে গেল। দাঁড়ান দাঁড়ান ম্যাডাম দাঁড়ান।
So I think I'm audible. So we are about to start. So
লিঙ্কটা দে।
So we start with today's lecture, which is the session with ethical handling and care of laboratory animals. I think everyone can hear me, right? So I request you to please follow me. The lecture will be in English, but of course I know there are some vernacular limitations. So if you can't understand any terminologies, you can really raise up your hand and I can really address you. So be very free between the presentation. Okay. So first, as I always said, this topic, today's workshop, we are actually basically dealing with the core techniques in experimental pharmacology and animal handling and goods of administration. So basically, we want to give you our information about ethical handling and how you should care of laboratory animals. People who have already pets at home, I think they have a lot of care for them, right? We know when to give them food, when to nurture them, when to clean up them. But when we are doing some science, right, and we are using this kind of animals who cannot speak, don't have anything way to express. So we have to be more careful dealing with such things. So there comes the point of ethics, and next comes to the care of laboratory animals. So basically, the starting point of today's discussion, it's a discussion. So first, the discussion starts, what is the role of animals in scientific research? Why we are considering animals? Today, as our professors has already said, we have prediction tools, we have simulations, right? But still today, we are still targeting for explorative research. Why preclinical study? Why animal study? So there comes some answers for this, the purpose of animals as the experimental model. So first itself is the word veterinary research, where we know a medical part of a medical science which deals with the animal physiology. If we don't do the animal research itself, the veterinary research will be stopped. We cannot identify the diseases, the new symptoms which is coming up from the animals. Next, we talk about the investigating the animal behavior, which we can extrapolate to some of our human nature, human behaviors. So, like the stress mechanism, stress management. Next, we are talking of some non-pharmaceutical products where we are dealing with some toxicity studies. That whether that will cause some havoc, hazards in the body or not, or unknown side effects. Next, coming to the pharmaceutical drugs, where we know there we are preclinical test, which is on the humans, which is coming up in the phase 2. But before that, also we need to submit the preclinical studies for to the all the regulatory bodies, and of course the biological research, the disease models, we using cancer research, xenotransplantation, we know genotoxicity, mutagenicity. All studies are somewhere dependent on this basic platform of the scientific model of the animal research. So, firstly, some facts. Why still we follow this pro forma of doing the animal experiment? I think you all heard about the story of thalidomide by this time. You all know what is thalidomide tragedy. So thalidomide tragedy, as we all know, it is the 1500 babies who were being congenital anomaly with the defective genes for Fumalia. So if that time this animal experiment would have been implemented, okay, so this disaster wouldn't have happened in the world, right? So from there onwards, the new studies for new any drugs, the pregnant animals were being treated to come up with any drugs, whether it is safe during the pregnancy period or whether it is causing any kind of in utero development hazards, right? Next, coming to the facts, why we need animal experiments. I think everyone will agree with me. We eat more animals than we do research on it, right? Activists say no animal research, don't kill the animals. But I think you use billions of chickens, 395 chickens, rather you are using just 95% of the animals what you are using for your test. And most of them what are the rats and the mice, right? Next, coming to the overwhelming support from the professionals. So, if you see the science, right, Nature is one of the landmark publishing house like Nature. So, Nature has given us a data where thousands scientists have come up with the support of why they need animal study. And in this condition, there was a lab visit to a scientist lab who is actually working with the pirates, like the apes, right? And there was laymen who went around to this lab to see how this person is working and doing experiment on apes, right? So they said, oh, it's a fine study, so there is nothing called which is hampering the ape, or the behavior of the ape is not acceptable. So when you are into this kind of environment approximately, you really understand the importance of doing this animal experiments. Next, coming to the laws. I think our research directors have highlighted this part, that when we are doing such experiments, there must be some regulations. We cannot pick up any animal from the road or from the street and start giving them injections or start giving them dose. That is the inhuman. So we have to treat them as the human environment. And for this, the laws have come up. That for this, the regulations have come up. And it has been first been implemented by US FDA in the 1966. But I will not go to that. I will talk what we follow. We follow in India. So here we have the CPCSE guidelines, which is now being considered as a CCSEA guideline. There I have highlighted. You can see here the link is also here, which is actually the committee for purpose, control, and supervision of doing experiments on the animals. So all the guidelines, what form we should know, what are the forms for taking approval for animals. After finishing the experiment, what form we should fill it up to say that my experiment has been completed on the animals. What are the procedures? What are the protocols? Every detailed thing you have to maintain in the form to get the approval that whether you can conduct the animal experiment or not. And as our coordinator sir said, that from our institute we already have the CPCA approval from the last 9 years. So we know what are the regulations we must follow, and we will teach you maintaining all the standards and compliance to this particular guidelines. So you will not know anything in human. Whatever you will know, it has been addressed in the guidelines. Next, coming to the treating animals giving better results. So the first thing is why I am giving pain and why I am giving suffering to those innocent people, species. No, I need something, right? And always my motive should be that my risk should be less than my benefit. So whatever I gain should be more in giving the pain. So in this comes up that whenever you treat your animals, you treat them in a way that you give a better quality of the experiment, the reproducibility of the experiment, the safety of the experiment, the compliance of the experiment, and of course the ethical consideration of the experiment. If you think the animal is getting a much pain, so either you should euthanize the animal, rather you could not continue the animal to continue the pain. I give a short brief example. Say we use a cancer model studied in the animals. So when you induce the cancer first in the animal, the tumor is becoming more painful, the animal could not survive. So it is better you euthanize the animal in a more human protocol, so that the animal don't have to take the pain for the next 21 days of your study. So this is what this giving you best results. So in this comes the 3R concept. So what are the 3R concepts? 3R concept says refinement, reduction and replacement. What are these 3Rs? Let's see. Refinement. Refinement means when you refine yourself, minimizing the pain and suffering to the utmost lower level. How much minimum? Because based on that only CPSA is going to approve your protocol. They will not approve you when your protocol will say much greater way to give the pain. If there is a way that you can minimize the pain, right? So that is one of the major criteria how you are going to define or design your protocol for the animal handling. Very, very important. So refinement is what? That is where you are minimizing the pain and the suffering from the animals. Then comes the reduction. When you are using the animals, even the higher animals, say for example somebody is using rabbits or these kind of animals, reduction in the number is a very critical phenomenon. Because when you use a higher animal, out of what you have to justify for what you are using. Say you need 5 animals in a group to get a good statistical data. That will give you what I mean by statistical data. It's not that this group has 5 and this group has 4 and you get a data. No, statistical data comes in a different approach, that you have to consider the significant difference. The significant difference can come if you are using 2 also, if you are using 3 also, if you are using 5 also. Now this question can come from the audience, madam, why are you saying such numbers? Do you know, do you dream of such numbers? No, I don't dream of it. Because the statistical analysis, the biostatistician, what they do is, when they know your protocol, they first calculate your total sample to get the statistical significance. So your total population data will be first calculated by the biostatistician. How much total number will give you for this particular model or this particular protocol to come to land up with a significant result where you can compare A with B, right? If the protocol says only 2 animals will be fine, you will take 2 animals. There is no point to take 5 animals in the group. And it also depends on which category of animals you are considering. If you are taking rodents, whether you are taking zebrafish, whether you are going for rabbits. So there is or guinea pigs. So there is a varied condition where your number can be controlled, defined, and you have to justify in your protocol, that is. Next, coming to the replacement. Now this replacement have 2 parts. From the word replacement you mean what? That man is saying something to replace. इसके बदले में कुछ और है. तो क्या है इसके बदले में? इसके बदले में क्या है कि relative replacement and absolute replacement. What I mean by relative replacement? When I say that ethics says that don't give much pain to the animal, you have to be human to treat the animal. That means you will give the minimum exposure to the pain of the animal, but it is not that you will completely exclude the animal from your study. You will keep the animal to your minimal use, right? But then what can I say about the absolute replacement? There are a lot of scopes for
models. Like you have prediction AI tools, you have cell culture studies, you have ex vivo in vitro studies, where you just take the attenuated tissues or attenuated cells of the animals and you can do the similar kind of experiments, right? So here it is the one that the absolute replacement and the relative replacement. Okay, so this is being introduced by Russell and Burke in the year of 1959, the 3R principle. And this 3R principle will be very helpful for you when you are doing such practical experiments in the lab with animals, and also when you will be following the workshop. Next, coming to the which kind of animal we are usually choosing. That is another basic model question. Why should I choose? I can choose a bigger animal, but I am usually coming to frogs. I am usually talking about rodents because we want to study the whole life cycle, the whole period from the birth to the death. In that whole life cycle, I can treat with my drugs, or I can create a model, I can induce the model, I can again recover from the model. So that is one of the targets why we are choosing the short lifespan of the animal models. And of course, some tests cannot be ethically cannot be performed in the humans. So why I say this word? Because there are such hazardous implementations in the Act of World Medical Association and the Declaration of Helsinki, as we all know, that in 1964, after the completion of the Second World War and after the thalidomide tragedy, really it was being strictly prohibited that nothing chemical with an unknown definite symptom you cannot apply for the humans. So for such study like genotoxicity, carcinogenicity, mutagenicity, for all such unknown side effects or hazardous adverse effects, of course, animals are the poor fellows. Okay. Then, of course, today, if we stop the animal testing, we know our science will stop right here. Because the next, we don't know. There is no answer to the next question. What's next? Nothing is next after this. So, the 100 years of animal experiment, animal research, today, whatever drugs you find in your bedside is because of this last 100 years of span of studies which have been conducted into the animals. So next I will come to what are our experimental models. Usually we are frequently using the small animal models, but right now I will be focusing on these two which you will be also be exposed. That is the mouse model, that is the musculus, and the rat, that is the ratus norvegis models. Okay, so mice and the rat will be our main target for this 3-day workshop. But there are also other like guinea pig, Syrian hamster, which are also being experimented under the small experimental pharmacology animals. So let's find out what are the types. As I said, the lifespan of the mouse is around 1 to 3 years. So it is very easy for a study for maintaining a 1 to 3 year study. And also they are very small, they are well adaptable in your palm. You can also handle it, but you have to softly deal with them. Okay. So it is usually coming to 20 to 40 grams, which is very small in size and weight. And there are several genus and species of these mouse models. So most commonly we are using the albino mice, Swiss albino mice, but there are also bulb C, VL6, which are the transgenic models which are being used for the mice models. But in your case, you will be using the Swiss albino mice. Okay. So let's talk about some of the behaviors, because you will know, if you know all this, then it will be easier for you when we show you the demonstration. What are the nature of such kind of rodents? So the animal behavior, usually the thing is they sleep in the daytime. They are all the nocturnal species. In the night, if you enter the animal house, you will see all the drums are banging. Okay, so they are very active during the night, but in the daytime, when you disturb them, they will bite because they are sleeping. So it is better not to much disturb them. Adaptability. Adaptability is what is we all know. You are also here to adopt. Adaptability, how much easily you can be, that is one of the more things. So we will always try to take those animal models who have a easier prone to adaptability. I will not take a cat in format because I know how cats are, right? People who are having pets at home cats, they know how to deal with the cats, right? So this adaptability is also a plus point for the rodents. Then olfaction and audition is highly sensitive. So whenever you are entering or whenever we are doing some kind of neurobehavioral study or some instrumental analysis, we know how sensitive they are. Even if you are whispering that sound, they can audible to them, right? So the olfaction is very very sensitive. And of course the long whiskers. Why they have long whiskers? Can anyone tell me from the audience why they have long whiskers? You know what? Sensor, yes, absolutely. So whiskers are also their sensory organs. They can, with the whiskers, they can sense their surrounding whether they are safe or not. Okay, so that is also one of the sensory thing. And of course, that is what is when we are handling them. We should be in a very calm and quiet. Your hand should not be very tense, and because they can feel the vibration in your palm. So you must be first. You must be very cool and relieved, relaxed, and then you should touch the mice. Okay. So nourishment, we are all giving them pellets, which are the solid foods, and also we know they are in nature is coprophagic, they feed on their fishes, and of course they have a diastema, the long teeth, which they are having this biting. So the diastema is a very, be careful of that. Okay. Okay. Next, coming to the Rattus norvegans, the rats. So they are also very beautiful, but just bigger in size. So at the first you will be little bit terrified. So the Sprague and Wister rats we have here. So we don't have the Sprague, but right now we have the Wister rats. Along with that, we have several other types also, which is like brown Norway, Zucker, RNU, long events. These are very unique models of the rats which are being used. And here also you see the lifespan is very less. So if you take a rat model for any study, 2 to 3 years is the total lifespan, and usually the adult body weight ranges from the 300 to 500, and it should be considered that the males are usually having a larger body weight in comparison to the female. It's as obvious. So what are their behavior? So usually rats are little bit less aggressive than the mice. Mice are more it's very difficult to hold on to the mice than the rat, and moreover rat are bigger size. So it is your capacity of your palm to hold the rat will be easier. Next coming, young rats are very agile and if they are in the crowded. So when you just from the vendor is giving us the rats, at the beginning they are very like 1 or 2 weeks or 4 weeks they are bringing those rats. So we have to be very careful that time, because in the beginning the youngs they are more agile, they can die more. So we have to really take care first during the process of adaptation and acclimatization that they don't die. So we have to give them proper space and nutrition, water, daylight, night. Every parameters has to be well controlled. Okay, for their development, because they might cause to heat death, because the mandatory for the animals during the the heat in the summer, if the AC is for half a day also it is closed, we see like 2-3 animals are already dying in the basket. So it is very much, they are very much death is very much frequent for them. And of course these are also coprophagic, they are omnivorous. They nourish, of course, in the night. As I said, they are more active, so they will feel more hungry, and the nourishment is also more during the night phase. So, after reading this whole behavior, right? Now I am a scientist. Oh, I am a great scientist. I just enter the animal house. I want to make some data, and I come up and I start. I take the animal from this basket to this basket and this, and I want to get some blood or plasma. Should I get it? Should I get it? You heard of the behavior. I described all the behaviors. Say, I know your nature, how you are. You know my nature, how I am. So now you purposely do something which I get annoyed, which I get irritated. So do you expect me to give you a good result? Of course no, right? So this valuable, before getting the valuable data, what are the deviating factors? Very, very important. What actually deviate? So you have kept them in good cage, you have given them food, you have given them water, you have given them night, daylight, everything is given them. But still in the morning when the scientists go with the record to see that how they don't get anything. Why? Because that you just woke me up. So they are very sad when people just wake you up from the sleep. Are you not annoyed? So I say in the daytime they are sleeping. So you enter there and what I mean by circadian phase. What you know circadian? Do you know this term? Circadian phase. Anyone's your circadian rhythm? You heard of this term circadian rhythm? What is circadian rhythm? Your biology clock. Right? So this is very important. Your metabolism. You know, in the morning I have to take breakfast, right? Now say today you are traveling in a flight, and in the flight you don't see the morning. You are still at the night, but you are feeling hungry. Why? Because in your homeland, you know this time is your breakfast time. So the circadian rhythm, circadian arousal is very, very important for getting a proper reproducible quality data in the animals. Then of course the stress. You cannot continuously stress them. Then they will agitate it, they will bite you, they will run from there. So never they will give you the normal result. Coming to the weather conditions, as we are also human, I said they are also humans. They are also people who just cannot express like us. So when the weather is gloomy, dull, you will go to the animal house. Our students, they will say, "Madam, they are not moving. Also, they are not drinking. Also, they are not eating. Also." So that means shows what they are not feeling good that day. But if the day is sunny, it's very bright. As we feel happy, I know you are enjoying with the tea, but please. Okay. So the thing is this is also a deviation factor. So when you do the animal study, you must also notice this deviation factor should not come to your study, right? So the next is the experimenter, that is me or the person who is doing the experiment. My process guideline should be well compliant with the CPSCA guideline. So if I know all my protocols, if I know proper guidelines, I am confident that I am going to end up with my good result, which will be reproducible. Coming to the interstrain differences, what I mean by interstrain differences, this is a very scientific knowledge I like to share with you. Say for example, my one student is working on blister rat, my another student is working on spread rat. You say, madam, both are rat, both are giving good, but no, there will be the interstrain differences, both stress level, both food level, the requirement of the daylight, night light, the attitude, the behavior will all change. So you cannot do any experiment with interstrain species. You have to consider same. Say for example, for you, for mice, we will be constant with the Swiss albino mice. So you all will handle Swiss albino mice. For that, everyone will handle blister. There is no variation in the interstrain differences. So this is are the deviating factors, and of course there are some, as we know, human error is one of the unknown factors. There are several unknown factors which we have to deal with. So this is what is the we must see. Yes, your question. Yes, interstrain difference I need to say is when you are taking animals from the same genus but different species. Say for example, I showed you rat model. I come back to my slide here, back here. Say I take an example. So here you see Louis Pratt dolly and another is the Mr. Rat. Both is looking white in color, right? So one group is using Pratt dolly, other group is using Mr. And then you compare your data. You say why we are not getting the same data? There will be definitely difference. Because say for example we all are Indians, but do we all think alike? No, right? So diversity is there everywhere. Okay. Next, coming to the another parameter, the laboratory environments, and of course, why sometimes our experiments fail because we are actually some disturbing factor, the environmental disturbing factor, that is the continuous, say for example, transportation. transportation. I'm taking my basket to this room to that room. Every day I'm doing. Every day I'm going and I am changing the chow. Or every day I'm going and changing their bed. Every day I'm moving them from one place to the other. So, or the garbage. Okay, every day you are going and holding them and making them forcefully drinking water. Okay, so basically you will find the animals will fail to gain any kind of weight. They are not gaining the weight. So you will be in tension. I need to gain because otherwise how I will do my study there solely. But you have to know what are the factors that is doing the condition. Next, coming to the transportation. So, two-wheel transportation, they can. We had a sad story last year actually. They were coming from Bhubaneswar, and in the train, how many animals it was? 40 animals just died inside the basket. They couldn't bear the heat, they couldn't bear the transportation. So that was a real limitation we have find out that due to the transportation, how these animals have been, they are so sensitive. Okay. Then we are coming to the man. We are always an environmental factor. Okay, everywhere. From the aquatic, from the aerial. So the man is the most violent character here. So weather, temperature, lighting for the sunshine, movement with the each type food, that is the chow which is every day we are doing. And of course then pairing if you are wanting them to breeding or mating. So we are always finding these things as the environmental violent factor. And of course here you can see the animal house picture. Okay, so similar arrangement you will also find in our animal house. Okay, it is already stacked like this in the basket. Next, coming to the acclimatization and adaptation, which is a very important factor. As I said, acclimatization is accommodation of the animals to the changed climatic conditions. So, if I'm going to now Himalaya, I have to get myself adjust to the 3 degrees Celsius. Again, when I'm coming down to Kolkata, I have to get adjusted myself to 40 degrees Celsius. This is acclimatization, and adaptation is what? That forceful. Like you have to adapt. Now you have no way to run away. So you have to be inside this room at this moment because ma'am is giving the demonstration. So if you want to go out and go for some other things, you just cannot do. You have to adapt. So this is what is adaptability. But in this condition, we should not be extra curious or extra worried. We should leave you in a relaxed mood. That will be easier for you to adapt. Right? If I be very with a ruler, why are you not listening? Then no. Adaptability has to be in a very relaxable mode. That will be easier for you to adjust. Now here I have given our data sheet where you can see there are several species and their adaptability capacity in the days. Why I am using this data? Because when my animals is coming from the vendor, I must know how much day I should keep for my acclimatization days, and minusing subtracting that day my study will start. So once you subtract your acclimatization, so rearrangement, changing the charm, transferring them, maintaining the temperature, maintaining the circadian rhythm, these all characters need to be adapted, otherwise you cannot start your study. So for all you see here, according to the species mouse, rat, whoever is having the case. So in average, we are usually, as we are dealing with rodents, usually we keep a 1 week window period for the acclimatization and adaptation here. Okay. Next, now coming to the laborizing and handling the animals, how you train them. Training the animals in the laboratory conditions through generations where territory is surrounded by the cage. So first you are training them by your boundary is the cage. You cannot run a whole floor of the animal house. No, you cannot do it. Next, run away from the enemies. Not needed because of course they are in the controlled or regulated environment. Searching for food and water because it is also not that because they are now being given. They can easily come to the basket top and they can get their food and water. No rivalry. So you must always keep them so that they don't fight within each other and kill one, start breeding. If you animal in one basket, usually we can see such phenomena happening. Okay. Specific noises, groups of animals, we should be avoiding. The basic criteria is when you are start laborizing these animals in the animal house, the first term you should keep in mind, it must be a stimulus-less environment. No stimulus. So I am with us. I am in a free mind. That should be the point where you must deal with the animals. Second, coming to the handling. So handling. So when you are first say, for example, from today you will start handling them. That means what you are going to taming them. So your touch is new to them. So they must get familiar first way with your touch, with your hands. So that the next days you can feed them. You can give them some kind of drugs, right? So taming is a very important, and of course by taming them you should reduce their fear so that they can come to you. Otherwise, what will happen? They will be very houch. They will create a houch, and always you will find whenever you are dragging them, they will run from you and get inside the basket. So you should be always very much careful regarding this handling, because that is our basic technique, core technique, which we are going to demonstrate you during the 3-day workshop, and that you must get a good confidence that yes, I can handle a mice or I can handle the rat. So similarly, the grouping and the grabbing of the animals, restraining the animals. I will show you the pictures how you are doing the restraining. Of course, why you need to then say you are wanting to measure the weight of the animal. So you need to take it out from the basket. So you have to know how to take them out. You just cannot use any kind of system or measuring of the hand just to bring them out of the basket. So handling, not be able to bite. So you must always be careful that they should not bite you. Why they are biting you? That means somewhere you are wrong, right? You have given them some uncomfortable touch. So your taming was not good. If you are giving some uncomfortable touch, they will definitely bite you because that is their defensive mechanism. So that is the best thing you first have to learn. Have to be considered resistance, muscle straining, stretching. So they will resist you, but you have to stretch them with confidence. Okay. Important, be always familiar that you must go with a guide. So like teachers will be there, your seniors will be there, who will be already familiar with the environment. So with them, if you approach them, they will be easily being handled. So first let me talk about some pictures what you will be using. But basically, so what I mean by restrainer, the term restrainer means when you restrain somebody. Restrain means I am forcing you from the position, right? I am restraining you. So restraining first is the tail. So if I want to restrain, somebody will pull my cloth, right? Hold me back and they will not let you go. So first here we see that you can do the restraining of the tail, which is a very common process, because whenever you are going to take it out from the basket, the first thing which you will be using for the rodents is you have to take it out holding the tail. You can't hold the neck and take it out like a cat. But if you are holding a cat, will you hold the tail of the cat? No, right? If you are taking the puppy, how you hold? I'm a great dog lover, so I know how to hold the puppies. So you don't catch their tail, right? So that is what is the concept. That using a restraint. So people who will be very fearful, okay, they can, okay, no, I will not touch the animal, so they can use a restrainer here. But sorry to say, we will not provide you this because we want all of you to be overcoming your fearness. Okay, so you all will be very confident to handle the animals. So we will, they can be used in a restrainer. Next, coming to the open hand technique, you just open your palm and let the animal put it here, right? So they will find a new space, right? They were in the basket, so now they will be curious because your hand is a new place for them. So they will try to move around in the open palm. Next coming again is the tail. Next is a cup technique method. We just pull it up like with the 2 hands. Okay, very normal. But this I think you can't do with the rat, but of course you can do with the mice because of the small weight. Or another fear is, again I said, people who are little bit fearful, they can use the forceps. Special forceps are there. Ear forceps, you can hold it in the ear and take it out from the basket. Okay. Then mice training, here what you are going to do. So after I told you the methods how you are going to hold it back. Now after holding it back, what you will do, you have to do something, right? Either you have to feed them, you have to give them some injection. So here you see, usually we are following this technique of this training, that is the two-hand scuff method. What is this method? Two-hand scuff method. Everyone, okay? Two-hand scuff method you are going to use for the next 3 days. So you are pulling it from the jawline, choking it, not choking it actually, we will loosen it so that it doesn't choke their neck, and that's how we are going to hold it with the support of your fingers. And after that, you're going to turn it upside down, hold the tail in your little finger, and then you can see here two types of injection modes. One is this is the intraperitoneal mode here, okay, lower abdomen, and here if you are giving to the, this is the intramuscular, because you know the muscles are in the heart region, okay. And also if you show the subcutaneous, we also will show you the subcutaneous, that is in the forehead, just behind the head region. You have to pull the skin, and this is the subcutaneous here, okay. Similar coming to the rat wrist trainer. Rat also here you can use a wrist trainer because they are bigger in size and people really fear to hold them. So you can put them in the wrist trainer and then put some injection in their tail. Next, coming to the one method of holding, grasping from the thorax. You hold it like this, grasping method. And another is the restraining by the tail. This is the grasping method in the thorax. This is one kind of method, and this is the restraining by the hand and the scuff. You just extend it for giving the intraperitoneal or intramuscular, similar to the mice. And this is the another which I said, the scuff technique. One is the thorax restraint, another is the scuff. Now there must be a question, madam, in which time how we should hold? Question coming in mind. सबके लिए एक ही मेथड है कि अलग अलग है, अलग अलग है. So like when you are wanting to give injection, right, in the intraperitoneal or intramuscular, I think this method, I don't think I'll say this method is easier for you, right? So you fix the head region here, and you see the abdomen region is very free for you to give the injection, right? But for example, when you hold it like this, when you want to give the oral, okay, so you need to open the mouth, right? That time you cannot hold it by the thorax. So that time, this kind of stuffing from the two hands, the rack here, you need to overturn it, right? Another method, very clever method. मुंह में कपड़ा दे दो, मुंह में कपड़ा दे दो, so they will be in the darkness, and you push it up to the textile cloth, and from the tail you can give some so you can give here the intramuscular here. So if you see the hands, the grip of the hand, so you are in a position that it will not move. If you move, what will happen? The needle will push it and give them pain, and the bleeding will start. That is not our desirable. So you have to first make them completely immovable, and then you have to fix the injection in the intramuscular region. And of course, here we have shown how you are positioning them for the intramuscular injection for the textile membrane. Another thing which we will like to demonstrate you how you will determine the sex of the animal. So we will ask you to restrain the animal and tell us whether it's a male or a female. How you will say us? That will be one of your exam. Okay, verbally exam. So firstly, you have to show the sex determination. So it is very easy in case of rodents. So the distance between the genital and the anus, you are actually measuring to determine the difference between the male and the female, right? So in case of female, it is greater, and in case of male, it is less. Okay, that is a very basic difference. And if it is an adult one, you will see also the very prominent scrotal sac. Okay. Next, I would also coming to this part that what is actually the describing all these methods. The first and foremost thing, two things we have to come in mind. Ethics, ethics comes when you finish doing all these experiments. Then what you will do? You will leave them just like that? No, they have a cycle. You have to finish them, right? So you have to know the correct procedure as per ethics, the euthanasia procedure. The killing should not be also painful. Either you can do cervical dislocation or you can use the list of chemicals which is being designated under the CPCSE guideline for killing them in higher dose. You giving some anesthetic dose also, right? So that they can not get recovery, they can die in peace. So euthanasia should be very peaceful. This is one of the ethics. And after euthanasia, biohazards has become now the topic of the town. Every inspection, biohazard. Every the document, biohazard. So what is actually biohazard? Biohazard is the important thing हो गया. तो gloves इधर फेंक दे रहे हो, gloves को pocket में रख रहे हो, needle. Even I have seen HAP students, first year B.Pharm students, they are piercing the needle but keeping the needle cap open in the lab, right? Because they are not aware of the biosafety and the biohazard. It is not only that you are using a disposable syringe, my child. Even if your disposable syringe is being used, anyhow, if you are contaminated with any blood drops from anyone, it can lead you to death. As simple as that. So today that is the reason biosafety level BSL lab categories level 1, level B, level C has been designated. Staff education is very, very necessary. So when we are going to demonstrate you as from the staff's point of view, we are also going to teach you how you should dispose them, how you should after handling, how you should finish them. So that is one is the biohazard and bio things. But why we are talking about all this? Because inhalation risk factor is there. Somebody can inhale those pollen grains or aerosols, anything like that. Pipetting, opening the culture. So somebody is doing cell culture work. From the cell culture also so many contaminations, so many microbial growths can happen. So you have to all agar place, everything has to be disposed in the proper manner. Handling the specimens, spears. If you are taking a blood from the animal, you have to handle them in the proper manner. Okay, so you are using some, say, capillary tube to take the blood, and then you leave the capillary tube on the table itself, right? It is not the correct thing. So you have to dispose the capillary tube in the proper biohazard dustbin, because that dustbin is being labeled with the biohazard sign. This is the biohazard sign. Okay, so you must always dispose your disposables of biohazards where you find the dustbin labeling this. You will not dispose them in the same container where you are disposing your food. No. You understand this? So prevention rules and hygiene has to be maintained. Biosafety level, animal safety labs has to be established as per the guidelines, which is the ABSL, animal biosafety levels, and also for the microorganisms when you are dealing with bacteria, one level BSL1, when you are dealing with virus BSL3 or fungi. So that level has to be dealt with the biohazards. So biosafety was being introduced in the US department, in the CDC in the year, and of course the biosafety in the microbiological and biomedical laboratories, where they are talking about the BSL levels. As per that, you are getting the regulations and compliance of those laboratories. Okay. So where the infection with the pathogens are being very under limits or under limitations in the workplace and in the environment, so that from there it does not spread to the community. So we all learn the social and preventive pharmacy that starts from right here. Coming to the biosafety in animal facilities, of course, the decrease in the likelihood of transmission. As in the very beginning I said, why we want to do animal research? Because we want to know about the veterinary research. We want to know what disease is causing by the animals. We are one of the bioreservoirs of the disease, right? We know swine flu. From where it came? It came from human? No, it came from the pig. So if we don't do research on them, where are the biological reservoirs of the diseases, we can never be able to escalate them or extrapolate those diseases in the human. So animal research is that very necessary for us, even in today's world when we have millions and millions of AI prediction tools. And who are the AI prediction tools? We are the one who is predicting and entering our data in the library. So whose library is the best? Our college library, we know whatever books is there. Just you are not taking the hard copy, you just using some software tools to handle it. And that's what is there. So for the next 2 days, me and my human, anyhow I can't able to take my this person like this here. So we should make a good team, and thank you all to attend this presentation. So thank you all for having this patience with me, and I will be open to all your questions. So me and my human will make a good team for the next 3 days. Thank you all. So I will be open and very likely to take up the questions from the audience. Yes.
And in case of emulation, how should I use animals? And you told about the IP route and IP route.
So okay, yeah, very good question. Yes. So when you are doing some inhalation study, say you want to do some nicotine exposure study, right? So you have to make a chamber where the animal will be exposed to that nicotine exposure gas level. Say you want to do carbon monoxide study. So the animal has to be exposed to the carbon monoxide chamber. But you must not go to that level that it should die out of hypoxia suffocation. You want to check the carbon monoxide poisoning, right? So your level should be as per the guideline. And how to go with the guidelines? So I must also come up with this. So as I mentioned about the CPCSE guideline, along with that, you have to also know about the OECD guideline. What OECD guideline says? The OECD guidelines give you the chemicals which are being used into the toxicity level of any new thing, any gas, any chemical, any extract, whatever you are feeding to the animals, we must be clear about the total level, acute toxicity level and the chronic toxicity level whenever you are exposing them to any nutrient, either in form of gas, in form of vapor, in form of liquid, or in form of injection. Okay? Thank you so much. Thank you. Anyone else? Okay, so I will request all of you to next move on for the next section. But should we start now for the handling session, or we can give a tour? So I will request for the so you can tell them what the next thing is. So next session we will go with the handling today. So you will go down to the animal house in the lab. So we will first today learn the handling of different species.
Okay, I have one question.
Yes, sir.
Actually, I was watching your website in the online video.
Yes, sir.
In the room I was watching.
Oh, thank you, sir.
Okay, I was only one question. Okay, maybe useful for this audience.
Okay, please, audience, a little bit silence, please.
Okay, I think you have taken a good effort to giving all the aspects of the animal handling. All those things is good. My simple question is, okay, because experiments you are conducting in the mice as well as rat. What kind of experiments can be connected in rat? What kind of experiments can be connected in mice? Whether it can be vice versa.
Okay, yes. So firstly, I will come address to such question. So when I have come to some of my, I just go back to my previous slide, sir. So when we were talking about behaviors, we first have to know what is the nature, what is the behavior. So here you see, I say they are very sensitive. Their very sensitive nerves are very much active. Okay, they are very aggressive. Say for example, let me tell you. But when I compare this behavior with the rat, for example, if I compare to mice and rats are less aggressive than the mice. So if I do some depressive models, say for Alzheimer or dementia, so should I apply to mice? Because mice will never get depressed. So I can create a depression model more easily in the rat model. So any kind of neurobehavioral study, core neurobehavioral study can be well accepted in the rat. But if I go say for example, please, I will request you not to discuss within yourself. If you are going for some metabolic disorder, say for example diabetes, in those conditions, sir, the experiment can be conducted in both in mice as well as in rat, because both are having similar metabolic function, similar circadian rhythm, similar type of intake of the food. So that kind of metabolic disorders can be studied in both. Even if you are using cancer models, in mice I must say I will come into xenografting and this because of the small size and very little time span. Because to induce a cancer only it takes around a month to develop that tumor. So of course for cancer studies, that is the best model. And of course we also should know the genetic expression for the cancer gene is much better in rats in comparing to the mice models.
Another thing, madam, I may add, in case of pain model also, sir.
Pain model.
Suppose pain model we are using both the rat and the mice, but in case of suppose the rhythmic effect, by using the acetic acid induce the rhythmic effect of the pain model, we are mainly using the mice. But rather than suppose calagin induce power, we are using the mainly that are using. In case of the we are also using the hot plate by inducing the temperature, we are using both rat and mice. But in case of the acetic acid gives rhythmic effect for the analgesic activity, then we are using the mice. Okay. Wound healing or no. In case of some wound healing activity, we are also using the mainly the rat because the surface of the upper surface is more. Okay. Then we are also using the rat.
But sorry for some like immunological study, we transgenic models,
Yes.
we are using mice.
Mice.
Transgenic mice, that's the
Mice.
LCG has lasted.
We have seen like
Best
that.
model for the
For
transgenic,
enzymes.
when you just insert some other gene and you want to check it. That will be better than the rat model. So transgenic models will be more better in the mice.
Thank you. Thank you, ma'am.
Sir, any questions? Okay, thank you. Okay, so next.
Thank you, madam, for the valuable discussion. Overall, madam covered everything. And I may add something. Yeah, I think you know that in case of the neurobehavioral activity, we are also using the rat and mice, but only within 3 months they will keep the neurobehavioral activity or well, in case of human beings, you actually in the your adolescent period, and like at the age of the 14 years, then the students or not, but human beings are mature. But that type of gifts like the affection, love, reproducible nature by the animal within the 3 months, and within 18 months, they will also give the more than 2 lakhs of the baby. Okay, so that's why that is also the advantage for using the rat and mice. You understand my point? So proper handling is very essential. That is also more sensitive in case of the specific area than the human beings also, and not only in case of cancer study, in case of the HIV study, diabetes study. If we are using the animal, that will be more costly, or we should have to give the different type of drugs to the human beings. They are also giving the toxicity. But in case of animal, we may purchase that that is very cheap, and easily we may go for the practical. Okay, and perform the different type of clinical activities. That's why we are choosing that animal, and you should have to practice properly and do properly. By this, we may go for the further study for the research oriented work after completion of the B Farm, or it will go for the M Farm That will be also helpful in case of you will go for the research and development. That is also helpful. Or in case of the preclinical study, that is also helpful. So ultimately, firstly, that is also essential for proper handling and the proper route of administration in case of you will go for the intravenous, subcutaneous, then intramuscular. So the position, the angle of the inducing of the needle also different. So that is also essential for the study. Okay. So you should have to learn. I will discuss and another faculty member also with the instruction regarding that matter. Okay. And any type of question is arising, so properly you should have to learn. That is also essential. Okay. And why you are using the intravenous? Why you are using the intraperitoneal? Why we are using the oral? That is also important. Which type of drug we are using the oral? Which type of drug we are using induced through the intravenous or intravenous? Why? Which is the more advantage? We will get the more advantage. That is also essential. Okay. Okay. Thank you. Thank you very much. Thank you.
So we would like to take you first to a 360-degree tour to our animal house facility, where you will see. But I think our sir will be here, Aman sir will be here. So I think you can go by groups, because as I said, we should follow. We should not disturb them, right? They are now sleeping, so we should be in a very little group, 5 in a time. So you can one by group will go and take a round to the animal house. And after lunch, you will start the clear? Okay, give us 5 minutes. Okay, we take the groups.
আর ইউটিউব এখন অফ করে দাও আমি তো বললাম ওই জন্য আপনাকে বলা